We know the UK is rich, spending $34 million on a wedding or $200 million on a funeral, kinda rich. So why are some people saying its health system is failing? The NHS, often cited as a source of national pride for the UK, is actually one of the worst performing medical services in the developed world. The Prime Minister blames the pandemic.
6 million referrals for treatment didn't happen during the pandemic. 6 million, right? And that's what we're catching up with.
At this year's election, the state of the NHS is at the top of many voters' lists of grievances, and both major parties have pledged to throw money at the problem.
A plan built on stable foundations with clear first steps. NHS waiting times cut with 40,000 extra appointments every week.
So how bad is it really? Well, patient satisfaction is at its lowest in 40 years. Nurses, doctors, ambulance drivers have all been on strike, demanding better conditions, better pay, and proper staffing. According to the British Medical Journal, the number of women dying in the UK giving birth, or soon after, has reached a 20-year high. 2/3 of maternity units in England are deemed unsafe. And as for the babies, Cuba has better infant mortality rates. What about funding? The UK boasts the 6th largest economy in the world. It spent $360 billion on healthcare in 2022, 11.3% of its GDP. Most other developed countries spend about the same, but they're getting better outcomes. For example, wait times. The British Medical Association says there are almost twice as many people on wait lists in the UK now compared to a few years ago. That's 7.5 million people. But analysts say it's not just COVID, it's because of years of underfunding, understaffing, and a lack of investment. Compare the UK to a few other countries and you'll see the difference. For example, one major study shows people in the UK wait longer for care than Russia, China, Rwanda. Or, for example, a coronary bypass patient might be waiting 5 times as long for surgery in the UK than in Italy. And all these delays are affecting the survivability rates of treatable illnesses like cancer. What about emergencies? Well, that's actually not any better. Someone who's had a heart attack waits an average of 45 minutes for an ambulance. The government target is 18 minutes. And if somehow you make it to hospital alive, well, you'll likely have to wait again. The number of people who waited more than 12 hours in emergency departments increased by nearly 25% in January. Compare that to, say, Iran, where one study shows patients wait an average of 45 minutes. Statistics show you're most likely to die in the UK waiting for help than in most other countries with similar health systems, like Spain, for example. The pride of the UK, hey? Well, if you're one of the millions of Brits waiting for healthcare, then probably not.